Hello, my name is Christopher Jamie, and I will be performing the intramuscular injection skills video. Here's my badge. These are my supplies. Okay, so for my supplies, I have clean gloves, my syringe and my needle, medication vial, gauze, alcohol swab. Okay, so to start off this video, I will go ahead and start by verifying the healthcare provider's orders. Once I've done that, I'm going to go ahead and verify the 6 rights of medication administration. So the first one's going to be right patient, right drug, right dose, right time, right route, and right documentation. Once I'm done verifying all of those 6 rights, I'm going to go ahead and check the patient chart in the EHR and verify the more. The doctor has ordered 6 milligrams of morphine sulfate IM. The medication is supplied as 4 milligrams per milliliter. So after calculation, the dose will be 1.5 milliliters, which equals to 6 milligrams. So today's dose is going to be 1.5 milliliters or 6 milligrams. Okay, so I will gather my supplies, enter my patient's room, close the door behind me to ensure patient privacy, and I'm gonna lay down my supplies on the clean flat surface, and then I will go ahead and hand hygiene and introduce myself to my patient. Hello, my name is Christopher, and today I'm going to be your nurse. Okay, I'm gonna go ahead and verify with my 2 identifiers. May I have your first name and last name and your date of birth, please? I will check on the wristband, and it checks out. This is gonna be my second check to make sure the medication is for the right patient. And okay, Mr. John, do you happen to have any allergies to food, medication, or environmental allergies of any sort? Okay, so my patient states they have no allergies. Alrighty, thank you, Mr. John. So today, your doctor has ordered an intramuscular injection of morphine sulfate. What is morphine, you ask? Morphine is an opioid analgesic. It helps manage moderate to severe pain by interrupting the pain signals to your brain. Okay? So some of the common side effects that you should be aware of is nausea, vomiting, constipation, and mild drowsiness. Okay? Some adverse effects that you should know of include severe dizziness, lightheadedness, and slowed breathing. Okay? If any of these occur, please let us know immediately. I'll be checking up on you, so don't worry. Okay? Okay. You might feel a slight burning or stinging sensation during injection. It's normal, so don't worry too much about that. It's okay. Now I'm gonna allow the patient to ask any questions. Mr. John, do you have any other questions for me? No questions. I will prepare the medication and I will verify it for the 3rd time. Okay, I'm gonna go ahead and perform hand hygiene. Apply clean gloves. Like so. Okay, now I'm gonna take an alcohol swab and clean the top of the medication vial. Toss this in the trash. Discard of this. Okay, now I'm gonna select the correct syringe. So here's my 3 milliliter syringe. Toss this in the trash. And here's my 22 gauge 1-inch needle. Toss this in the trash. Connect. Make sure it's securely fit. Now I'm going to draw 1.5 milliliters of air. Like so, verifying the camera just to make sure. Okay, now I am going to remove the cap and insert the needle into the medication vial. And I'm going to push the air out. And now I'm going to invert the vial, and I'm going to draw 1.5 milliliters of morphine. And now I just got to push any air bubbles out, and then remove the vial. And I'm going to use the scoop method to apply the cap back onto the needle, like so. Close the needle, close the cap, lay down my syringe here. Oh, sorry, and just to verify that it's 1.5 milliliters, I will show the camera, like so. Okay. Okay, now that I've drawn the medication into the syringe, I will look for the injection site. Now for this injection site, I will use the ventrogluteal muscle. So to locate the ventrogluteal site, well, first I'm gonna ask my patient for permission. Mr. John, is it okay if I go ahead and just touch your? Is it okay to touch you? Yes? Okay, thank you. So now that I have permission, I'm going to place the heel of my hand over the patient's greater trochanter, and then I'm going to point my thumb towards the patient's groin, right? It has to be perpendicular somewhat. Now I'm going to extend my index finger and towards the anterior superior iliac spine, and now I'm going to spread my middle finger back along the iliac crest to form a V, which is here, just for showing purposes. Now let's demonstrate on this piece of the prop. The V will be like so, and the injection will be at the center of this V. Okay? The patient would have laid on their side. Okay? So now, Mr. John, thank you for your patience. Please lay on your side. Okay? Now, I will inspect the site for bruising, redness, swelling, or lesions. And then I'm going to palpate for tenderness or hardness. Okay? Everything's good. This site is appropriate for injection. So now, I'm going to clean the site with an alcohol swab. Discard. And now I'm going to start inward, and I'm going to go 2 inches outward. Like so. Discard. Let it dry. I will not touch that site again. Okay. So now that it's dried, I'm going to remove the needle cap from my syringe. I'm going to hold the syringe like a dart, and I'm going to use my dominant hand, and I'm going to put the palm down, and I'm going to use my ulnar on my non-dominant hand. I'm going to do it so you can see it, and I'm going to spread the skin like so. I don't know if you can see. Can you see? Okay. Like that. And now I got to notify the patient. Mr. John, I'm going to give your injection now, okay? So now I'm going to insert the needle at a 90-degree angle quickly. Okay, now that it's in, I'm going to move my non-dominant hand to stabilize the syringe. And with my dominant hand, I'm going to pull up on the plunger for about 10 seconds to make sure there's no blood return. Okay, wait 10 seconds. No blood return, so this site checks out. Okay, now for when administering when injecting the medication, it's going to take 10 seconds per milliliter, so about 15 seconds for the entire medication administration. Okay, now that the medication is administered, I will go ahead and leave the syringe in for 10 seconds. Now I'm going to take gauze and slowly remove the needle and gently apply the gauze over. I will now discard the needle into the sharps container. I don't have one, so I'm going to just place it down in a bucket. Okay, so I'm going to hold the gauze here just for a little bit, just to make sure. Once I'm done, you want to make sure you don't rub the gauze or apply too much pressure. So now you're going to go ahead and check if there's any blood coming out of the injection site. You want to go ahead and apply a bandage, but there's none. So now I'm just going to discard this, and my patient does not need a bandage anymore. Now I'm going to first of all, you don't recap a used needle, just to let you know. So now I'm gonna go ahead and make sure my patient's comfortable, and I'm going to give them the call light. First I'm gonna make sure they're comfortable, remove my gloves, and then I'm going to perform hand hygiene. Okay, Mr. John, how are you feeling? Do you have any questions for me? Okay, I'm gonna make sure that the patient has the call light and everything is good. Patient is comfortable. I will exit the patient. I will grab my remaining supplies. I will exit the patient's room, and I'm going to document, and that's it. Thank you for watching.